The announced deduction of 1% is illegal because the unions have not yet been informed of the benefit package. The unions have also not been informed about the fund manager.
The deduction is illegal, is misplaced, and should not be tolerated. I therefore appeal to all judicially unionized employees not to allow a deduction of 1%.
Union leaders strongly opposing to government proclamations to the effect that the health insurance scheme deductions will be effected in July 2019. Government workers will be the first casualties in this deduction. But Zambia Congress of Trade Unions Deputy General Secretary Elaston Njovu says should the Ministry of Health proceed with the deductions, it will be acting illegally.
The Zambia Congress of Trade Unions is urging the Ministry of Health to halt their bad intentions of wanting to impose a deduction of 1% from the public service workers. And we know they have intentions of extending this to the private sector. We cannot allow this situation.
In Judiciary, an Allied Workers Union President Peter Mwale says this decision, if effected, will attract litigation.
Let me take this opportunity now to tell Health Minister Dr. Chitaru Chirufi not to even make an attempt to deduct a 1% from judicially unionized employees. Should we go ahead to do that this time around, we are not going to tolerate that deduction. We have stopped anyone to deduct 1% from our salaries. We are not interested in this useless health scheme that they are propagating. It is not serving any purpose. And if they go ahead this time around, we are going to challenge this deduction. We are going to seek legal redress. We are going to stop the deduction. We are going to obtain an injunction.
The two union leaders wonder why government is in a hurry to effect deductions without clearly explaining to those contributing to the health insurance scheme the benefits that will come with their contributions.
We have not been told who will manage the fund, how this scheme will benefit members, and how the fund will be managed. These procedures are supposed to be explained instead of rushing to impose deductions on workers. The Ministry of Health is also deliberately ignoring the fact that there is currently existing medical schemes in place in various institutions, including those in the private sector. The fund manager, we demand, should be known. The Ministry of Health cannot be the ones to administer this particular scheme, at the same time be the same to collect the fund.
They gave us 4%, but they have removed 1% again. It doesn't make sense. Which medical scheme are we talking about? We don't even know how this scheme is going to run, and how is government so quick in effecting a deduction without putting things in place. We don't know whether medicines are there in hospitals. We don't know how this scheme is going to operate. We are not told. All we are hearing are just announcements that no, this scheme should start in the next month. Don't rush into getting money from salaries, deducting salaries from people. No, it's not right. First of all, put systems in place. Let them convince us that yes, this scheme is going to work. You see, we are saying, why should government rush into deducting 1%? Why are they so much in a hurry, not putting in medical facilities? Look at our medical facilities in this country. They are in a bad shape. You see, they are nothing to talk about. So why should we be paying for something that we know are not going to get a benefit?
The Ministry of Health has indicated that the health insurance scheme deductions will be effected on civil servants this July 2019. Mwapek Mwenda, Prime TV News, Lusaka.